สวัสดีค่ะท่านผู้ชมขอต้อนรับเข้าสู่รายการนี่แผ่นดิน FampageStudio นะคะสำหรับวันนี้ค่ะประเด็นที่เราจะพูดคุยนะคะก็คือต่อเนื่องมาจากสัปดาห์ที่แล้วค่ะเพราะว่าสัปดาห์ที่แล้วเราได้มีโอกาสได้พูดคุยกับคุณบ๊อบบี้ไปแล้วนะคะเกี่ยวกับเรื่องไม่ว่าจะเป็นวิลล่าเมดิก้าที่มาที่ไปหรือว่ากระแสที่พูดเกี่ยวกับเรื่องของสเต็มเซลล์ในเมืองไทยนะคะวันนี้ค่ะเราจะมาคุยรายละเอียดนะคะกันมากขึ้นเพราะว่าพอมีโอกาสค่ะได้พูดคุยกับคุณหมอนะคะซึ่งเป็นผู้ที่รักษาอยู่ที่เยอรมันเลยทีเดียวค่ะคำถามที่จะพูดกับคุณหมอวันนี้แน่นอนคุณหมอเป็นคนเยอรมันนะคะเราก็จะต้องมีการสนทนากันเป็นภาษาอังกฤษบ้างแต่ว่ายังไงแล้วเนี่ยก็อยากให้ท่านผู้ชมเนี่ยได้ประโยชน์จากตรงนี้มากที่สุดนะคะวันนี้ค่ะได้รับเกียรติจากดร. เจฟฟรีย์ เฮอร์เกนค่ะท่านเป็น Chief Medical Director ที่ Villa Medica ค่ะสวัสดีค่ะ
สวัสดีครับRoy Good evening
Good evening I just mentioned that you are a doctor at Germany and last week we talked to Kun Bobby already and interviewed him about Villa Medica but this week we would like to know more in detail about the fresh cell therapy so can you explain what's the difference between like normal medical treatment and the fresh cell therapy
Okay Normal medical treatment, meaning conventional medicine, is based on a technical and mechanical understanding of a human being. Most of the treatments are symptom-oriented, so the patient is presenting a symptom and the doctor try to solve the symptom with his medication, with his treatment, with an operation, and so on. Fresh cell therapy is a part of holistic medicine, where we like to consider about the whole body system.I mean, we are looking for the symptoms, but we like to know what is the reason for the symptom. If someone is suffering from a headache, this is a symptom from what? So we are going deeper and deeper, and at the end we can identify the root, and this is what we like to treat.
And the cell of fresh cell therapy. What's the difference between fresh cell therapy and stem cell? Is it the same thing?
It is the same, and at the end not the same.Fresh cell therapy, also as stem cell therapy, is a kind of cell therapy. Cell therapy overall means that the doctor is using cells coming from a mammal to treat human beings. And stem cell therapy is founded in 1985. So there's, in the meantime, 10-15 years clinical experience.Fresh cell therapy is founded in 1931. I mean, we have in the meantime 80 years clinical experience. Also the same answer, it's the same and we are not the same because I think the huge difference is, there are two differences. One is the source. I mean, if we talk about stem cell treatment, we are talking about stem cells coming from your own body. It's autologous stem cells. So the doctor is taking something from your body, culture it in a lab dish and re-inject into your body.So
that calls stem cell.
This is the word stem cell treatment. We are not talking about aborted babies treatment or human embryonic cells because this is forbidden and ethically wise no need to talk about. Fresh cell therapy is different. We are not choosing something from an adult, not from a human being. We are choosing from an unborn fetus and our source is lamb.
Okay.
So one big difference is the source. The second.Huge difference is which kind of organ you can get. At the end, a human being is built from over 220 different tissues. And it looks like this is a research that every tissue has an organ-specific building cell or stem cell. If we talk about autologous stem cell, the doctor is able to take something from your fat, something from your blood, or something from a bone marrow. At the end, we are talking about 3 different tissues.But the function of the stem cell is organ specific. That means if I take fat cells to treat a heart condition or a brain condition or an age condition, is not really fitting for the need. If you like to treat with bone marrow disease, like what we are doing in conventional medicine with leukemia patient, this works very well. But if you choose bone marrow to treat any other cancer,like liver cancer, lung cancer, brain cancer, it's not working. With fresh cell therapy, I have a possibility during my harvesting and the production to choose exactly the same organ I like to treat for the patient. I mean, if I like to treat a brain disease, I choose brain because this brain is containing the same stem cells or the same building and regenerative cells like in our body. So if I like to treat liver, I choose liver. If I like to treat kidney, I choose kidney.
Okay.
So in principle, this is a very old nature medicine knowledge. We treat same with same.
So why you have to get the cell from sheep?
So as Nihans invented the therapy or found the therapy in 1931, he tested before many different animals. And all of them are mammals, breastfeeding animals. And cell therapy or fresh cell therapy work in principle with all mammal animals, but at the end he chose sheep because there he has the best results. Now, someone will ask why we treat a human with sheep cells. How can it be?
Yeah.
You have to know that the sheep is also, as a human being, a part of a mammal animal kingdom. And we are choosing the baby or the material before birth. So we are talking about an unborn baby lamb. And before birth, from the antigenicity side, is completely different as after the birth. So before birth, there is within the mammal group no antigenicity, no presentation of antigenes on the cell surface. And the building proteins of every mammal organ are in principle the same.
So originally they choose the cells, the fresh cell from animal.
Yep.
So why at that time it's not like human? Why at that time did not choose?
We have not the technique. You know, stem cell therapy, the word was built and found in 1985. So in 1985 they start with clinical experience. So, but this therapy is not really available for everyone, and is stucking still at the beginning. And fresh cell therapy is based on practical experience of a treating doctor. So as I said before, the last 80 years, 10 million treated patients. And we are not, it is, if you ask me, is the same gene, sheep and human being? No, for sure not. But the same building parts, and then we're talking about proteins, they are the same.
Okay.
And this is creating the effect.
So it's compatible with human body?
It is not directly compatible, but the building proteins are the same. So, and the source, or the age of the source is a crucial point. If we choose, what we are not doing, but in theory, if we choose a lamb after birth or an offspring, then we may have immunological problems. To create an immune reaction or to have antigen or immune information, you need contact with environment. You have to eat, you have to breathe, you have to drink. Then your body try and learn and create antigens presented on the surface. But before birth, 50% of a baby is coming from a father, 50% is coming from a mother, and if a mother has a problem with the proteins of a father, she will reject the baby. But this happened not. So the antigen presentation on the surface is like a white paper. There is no information. And if you use this material and transport it into the human being, there's also no rejection. I hear that from many, many doctors, but in our daily work we are not seeing any rejection. And in conventional medicine, if I use, we talked before about stem cells coming from adult and stem cells coming from aborted babies. If there are some countries on earth who are using aborted babies, and we are not taking any precaution. So we take the material, prepare it, bring it into the syringe, and inject in a human being. Later on, if you're talking about organ transplantation, everyone knows if I receive from a foreign human being an organ, I have to take medication to cut my immune system down, because this is coming from an adult, and the unborn baby cells, embryonic cells from human being, there's no precaution need. It's the same with an unborn baby lamb. There is no precaution.
Oh, I see. So it's the same.
It's the same.
Since you use the sheep cell, is there any case that patient allergic to the cell of the sheep?
We are treating around about 1,500 patients a year, and we are seeing from time to time allergies. But allergies is like near every human being has some kind of allergies. So we have overexpression of information, but we are not seeing severe anaphylactic reactions.
So that it's quite safe for, like, let's say everybody.
The therapy in principle is not suitable for everybody. We have their indication and contraindication. And before we treat a patient, we are asking for an extensive medical checkup, for a questionnaire, for blood drawing, and so on, to qualify or to disqualify a patient. So with this exercise, I like to ensure that the patient who is receiving the therapy is a good case.
That's why you have to check like many.
Yeah, we have a standard procedure. And cell therapy, doesn't matter we talk about stem cell therapy in a conventional way or fresh cell therapy, is never an urgent treatment. This needs time. What we like to do with fresh cell therapy is we like to give good information how to rebuild, how to regain an organ. This information is delivered through the therapy, and then this is interacting with your own system, and this needs time to show an effect. 4 weeks, 2 months, 3 months. So there's no need to hurry, there's no need for urgent treatments, and there we have time to choose the right patient for the therapy.
And for the treatment, do we need to come back like every 6 months, every year? You need to inject like cell. Do we need to do that?
Depends on underlying condition. We have patients, or the youngest patient we ever treated in our clinic, Medica, is 6 months old. The oldest patient is over 100, 103, 104. So there is in principle no limitation of age. There's also no limitation on gender, female, male, doesn't matter, or race. We have inborn disabilities like Down syndrome, Mongolism. There we start as early as possible, and we treat them every 3 months, every 6 months, every 9 months.
That means you can start from they're still young?
Yeah, we ask, please come early enough so we can create a better effect. If they come late, we can always treat them, but the effect is not so as when you start earlier. So if you talk about a normal anti-aging treatment to keep someone healthy, to keep immunity up, to keep the hormones up, then there's no need to repeat the treatment after 3-6 months. Then we do the treatment depending on the age of the patient, every 12 months, every 18 months, or every 24 months. The best experience we have in our clinic that if adults are repeating the treatment once a year.
Once a year. And for the kids or for
special
the child?
Conditions, then we are changing and saying, please come after 6 months, 9 months. But there is in principle no standard procedure. This is more
individual.
It's a highly individual treatment, and also the procedure is every time different. So sometimes they come after 3 months, and the next treatment saying, okay, now we can wait, come after 1.5 or 2 years.
Also, I read the article in internet about how you use the first cell treatment to treat the autistic child as well.
Yep.
So what's the case about?
Autism is a very sad disease, and if you see how fast this kind of disease is growing, it's unbelievable. It is at the moment in the Western countries the most common childhood disease. So at the moment there are some countries like the US, 1 of every 80 newborn child will be diagnosed with autism within the next 2 years. In Arab country, 1 of 50 child will be diagnosed within the next 2 years. So there's an urgent need to give a patient or give the parents something we can choose for the treatment. And conventional medicine at the moment, if we talk about it's based on a mechanical understanding, a technical understanding, and you cannot solve the problem with that. So if you calm them down with a psyche drug, you are not changing anything. So we are more calmer, but social interaction there is no chance for development. With fresh cell therapy, we have around about 10 years experience with this kind of disease. And we are seeing that if we treat the children, most of them are getting better. I will not say 100%. This is not true. But let's say more than 50, 60% are responding well to the therapy. And we are not talking about a cure. We are talking about make them better. And with every therapy, further therapy, there's another improvement.
And one last question, which is quite important because every woman would like to know that this fresh cell therapy can help in any beauty or wrinkle.
As you know, fresh cell therapy is a kind of holistic medicine. And a holistic medicine is a word for a medicine or praxis that is not found 20 years ago or 80 years ago. It is in principle all the nature medicine, based on nature principles. So in China, Chinese medicine or Asian medicine, understanding is that the internal well-being is directly connected to our external beauty. The skin is a mirror image of the internal well-being. That means our first aim is to optimize the inner well-being, the inner beauty. And then if you reach that, we have automatically that the external looking, the skin is getting much better.
So this must be like a very good question for all women.
Not only women, also male are asking for beauty, because what we are seeing with Medica has over 50 years experience in this field. We have treated more than 100,000 patients, and we see that patients are coming for diabetes treatment, for treatment after stroke, after heart attack. And if I repeat regularly the treatment, it's not only that we are getting here with a basic problem better, also the external looking is getting every time better and better and better.
ค่ะก็เชื่อได้ว่านะคะวันนี้ที่คุณหมอมาให้ความรู้นะคะก็เป็นความรู้เกี่ยวกับfresh cell therapy นะคะที่คนไทยหลายๆคนอาจจะยังไม่เข้าใจค่ะหลังจากวันนี้แล้วพลอยเชื่อว่าก็จะทำให้หลายๆคนนะคะเข้าใจเกี่ยวกับศาสตร์การรักษาร่างกายนะคะแบบนี้มากขึ้นค่ะวันนี้ก็ต้องขอบพระคุณนะคะคุณหมอมาที่ให้เกียรติเสียสละเวลามากับรายการของเราค่ะ Thank you so much and then looking forward to meet you again very soon
Thank you very much
ขอบคุณค่ะ
ขอบคุณครับ
เอาละค่ะสำหรับช่วงหน้านะคะมีสิ่งที่น่าสนใจรออยู่นะคะแต่ว่าสำหรับช่วงนี้ต้องพักสักครู่ก่อนค่ะ